Hey everyone, welcome to my channel. As you can tell, I've got a different background today. It's actually 4 in the morning and I'm on my way to get a spinal cord stimulator. Just another part of working towards alleviating the pain for my CRPS. I'm documenting this process in hopes that it might help someone else. Tomorrow morning, I'm going in for a cervical stimulator and a revision of my lumbar stimulator. I've had the lumbar stimulator for almost 2 years now, and the reason why I need the revision is because where they put the battery pack, it's almost at my butt instead of at my back, and because I don't have a flat butt, every time I sit down, it has pushed that battery up into my, I guess, back muscles, fat, whatever it is, and created a larger pocket. Instead of being this like tight, firm device that's in my back, it is loose and it turns and wiggles and it can actually like flip and it electrocutes me all the time. I should have 4 to 5 inch incisions, maybe, hopefully less. The battery pack for my lumbar stimulator is like down here. They're gonna move it to the middle of my back. The battery pack for my cervical stimulator will go right beside it. And then at the very top, like kind of the base of my neck, upper back area, I'll have another incision where they threaded the leads down through my spinal column. Those leads then connect to the battery pack. If you're looking at this video, I am sure that you already know what a spinal cord stimulator is because more than likely you're looking for it or your doctor has suggested it. If you don't know what it is, spinal cord stimulation therapy masks the pain before it reaches the brain. So if your pain is at 100%, it might decrease it by 50 to 75%. It can be delivered in 2 different programs. One is a lower frequency and the other is high frequency. I personally like the low frequency, which is where you can feel the vibrations. I feel like it masks my pain better. But a lot of people do like that high frequency where you cannot feel the stimulation, it's just working. From the Mayfield Clinic website, here's a picture of what the spinal cord stimulator actually does. The device is surgically placed under your skin and sends mild electric currents to your spinal cord. Thin wires then carry the current of the pulse generator to the nerve fibers of the spinal cord. When it's turned on, the spinal cord stimulator stimulates the nerve in the area where your pain is felt. First, you will have to have a trial, and it typically lasts between 4 and 7 days. I had a really rough trial because I did not know I was allergic to like every single adhesive out there. So I got like 2nd-degree burns all over my back. But it did help my hands, so we decided to go through with the surgery. Here's a picture of what the stimulator will look like. You will have leads that go into your spinal column, and the leads are then connected to a battery pack that is outside of your body. After that week, the doctors will take everything off, and then you will schedule your surgery if it worked. Not everybody is eligible for this surgery. Again, from the Mayfield Clinic, I'm going to go ahead and read what makes a good candidate. If you tried other therapies and they have failed, if you would not benefit from an additional surgery, the pain is caused by a correctable problem and should be fixed. You do not want further surgery because of the risks or long recovery. You do not have untreated depression or drug addictions. You have no medical conditions that would keep you from undergoing implantation. And you've had a successful spinal cord stimulator trial. With my lumbar spinal cord stimulator, I have had issues. With every surgery, there are risks. And throughout these 2 years, I have had some negative things that have happened to me. Not only did the original doctor who implanted it only implanted 1 lead, which did not cover any of my pain, they had to go in and do a revision and put more leads in so that it would cover more of my pain area. So now that it is flipping and electrocuting me, they have to do a revision on that as well. So there are things that can happen. I'm going to go ahead and read a few of the risks. Undesirable changes in stimulation, epidural hemorrhage, hematoma, infection, or spinal cord compression, paralysis, battery failure, battery leakage, spinal fluid leak, persistent pain, a pocket of clear fluid, which is a seroma, lead migration, allergic to the implant, generator migration, or weakness, numbness, clumsiness, or pain. Obviously, there are lots of risks. I have had some of them happen to me, but even with those risks, I couldn't live without my stimulator. It helps that much. From a Medtronics rep, I have heard that cervical stimulators can sometimes not work as well as lumbar stimulators. I don't know why though. That is something that you will need to discuss with your doctor and see if it's right for you. And that with everything that I ever talk about, it's never saying that you should do something or not do something. I'm just giving you my experiences in hopes that it will help someone. With the spinal cord stimulator, you have the remote, the paddle, the battery that's in your back, and the leads. This is the remote, and it's as simple as pressing the up and down button to change the stimulation. And up top, it's where the batteries are. It's your remote battery and the battery in your back. Once you are ready to charge your back, you plug this part into the remote, and this part sits on your back. So I will now have to charge 2 different devices, which really sucks, but it helps. Okay, so we are on our way to have surgery number 32. So sad. We've got an hour drive and then probably an hour to hour and a half before surgery. So we are at the hospital and we had to be here at 6 a.m. and the staff doesn't have to get here until 6:20. Like, that doesn't even make sense. But I am insanely nervous. I feel like I'm about to throw up. And I never get nervous before surgery, but this is like this is my last chance type of effort. So I guess there's more riding on this surgery. I'll keep you updated. Outfit of the day. Beautiful dress. Beautiful face covering. Hairnet. And socks.
Nice, comfy bed, right?
Oh, and the most comfortable bed ever. So, day 1 at home, it feels like I was ran over by a truck and stabbed in the back 4 times. My voice is super raspy. I don't know if they were rough with the anesthesia tube or if this is just how it normally is. I don't know, I can't remember. But my throat hurts, my back hurts. They don't turn on the stimulator until the 2-week appointment, and then it takes like another week or so to start working. So I won't know if it really works until about 3 to 4 weeks. But I did have that trial, and the trial proved that it did work. So they followed the exact same placement as the trial. And in 3 weeks, we will know if it works or not. During the trial, they used adhesive tape to hold down the bandages, and I am allergic to adhesive, and so it caused like severe 2nd-degree burns. So they used super glue, like, you know, surgical glue this time. Thanks, Mom. Surgical glue. And my doctor wants to send a home health nurse to do PT and to make sure that the incisions aren't getting infected since I have so many incisions. Today is day 4, and I've actually been able to get up off the couch a lot easier. It's still very painful, obviously, but I am still icing a lot. I was told not to heat because blood flow obviously goes to the incision and you don't want it to bleed everywhere. I think the bruising is not as bad as I thought it would be. I thought it would be really bad because I bruise pretty easily. My tips would definitely be to log roll out of bed still. If you have someone there to help, ask for the help. This is probably the 2nd toughest surgery I've ever had, so it's a tough one. Just relax, don't do too much. You can see I put on mascara today. I'm so happy. I did it from my couch, but You know, so I would definitely say ice, rest, and relax still. It's still pretty tough. It hurts so bad. I knew it was gonna hurt. I just didn't think it would hurt this bad. And I do know that I got, like, this surgery was more than what a typical stimulator surgery would be, because I had to get mine removed and then put in another location. So it's kind of like having two of the same surgery. So it was super tough, but for like 2 or 3 days, I wasn't wearing my gloves because I just felt, I don't know why, but they just didn't hurt. It could have just been my CRPS saying like, hey, I'm going to give you a couple days of freedom. And then, nope, just kidding. So I don't know, but we're back to this. And it's okay. No matter what, I do know that the post-op pain is temporary. And my CRPS is lifelong. So you just got to take it day by day and live for another day. Because you never know what tomorrow's going to bring. To show you where the old battery was and where it's moved to now. Batteries are side by side now. And I want to show you the actual size. On a lot of the websites, it says it is a small battery. But in fact, I would say it's at least medium sized. Here is the height of the battery. And another shoddy zoom work. And here's the width of the battery. I am 1 day before the 3-week post-op, and like I said before, at the 2-week post-op appointment, they turned on the battery and programmed it. They might have to program it several times before getting what I need to help me. I would say I got the first few days of relief, but that could have been from my CRPS just giving me a break. I don't know. I'm right back to wearing my gloves 24/7. I'm still in a lot of pain. So at this moment, I would say it's not helping much. But with my experience with my first stimulator, I had to reprogram it 100 different times. Not really 100, but I had to reprogram it a lot. And I'm gonna give this the benefit of the doubt as well, in saying that maybe it's not at the correct program. Overall, since I do have experience with the other stimulator, hopefully it helps. We'll see. I don't have like super great positive feedback right now. Going into this, I did know that, you know, I want 50 to 70% relief. And with my leg, it gives me between 40 and 50%. And that alone, I couldn't live without. So I know I'm not at the right program right now because it's not helping me to that extent. So, you know, I'll meet with Medtronics again, go from there. What I'll do, since I don't have that great feedback right now, throughout the next few weeks to months, I will update in that bar section that drops down, and I will let you know how it works. It honestly takes time to get that like correct programming down that really works for you. So I will let y'all know. I'll keep you updated and just go from there. I would say if you are looking into a spinal cord stimulator, definitely do your research, look at the pros and cons, because there are good and bad to both sides. Me personally, with my lumbar stimulator, I've told you several times I can't live without it. With my cervical stimulator, we'll see. It's still up in the air, but the surgery did go great. Post-op went great because my scars look amazing right now. You know, at the 3-week like threshold, everything else is doing great. I'm just not getting that relief yet, but time will tell. And I will keep all of you updated. Thank you so much for watching. I hope that it might help someone. Comment below. Let me know if you have had this and if it's helped you or not. Just giving myself and other people feedback and other ideas. That is it for me. Thank you so much for watching. As always, please like, share, subscribe, and if you want to follow along on my journey, hit that notification bell. All right, y'all. Bye.